responsible for being the sort of executive secretary writing the Australian Immunisation Handbook, and returned to that role roughly 2 weeks after having her first child, breastfeeding and continuing to write the handbook. So we have Raina to thank for that tradition. So congratulations, Raina. Woohoo! So we'd like to invite and perhaps embarrass Raina into saying a few words. Thank you very much.
Thank you, Peter, and I'd like to acknowledge the traditional owners of the land, the Wiradjuri people of the Kulin Nation. Thank you. I'm honoured to receive this award. I'd like to thank the PHAA and the organising committee, and also my team at UNSW who nominated me, especially Anita Haywood, but also Holly and James Wood and Tony Newell, Linda Lawrence, Heather Gidding, Betty Liu. I was quite surprised and touched when they told me they'd nominated me. I've been working in this field since 1991, almost 24 years, and I've spent 14 years at NCIRS. I'd like to acknowledge the Foundation Director of NCIRS, Margaret Burgess, who's been a mentor to me. I started at NCIRS in the year 2000 and still have an appointment there thanks to Peter MacIntyre. I'd also like to acknowledge Peter, who's established an excellent link between NCIRS and UNSW in modelling the vaccine preventable diseases, and I thank him for his ongoing support and friendship. In 2001, it was actually Margaret who always kept a keen eye on the latest developments in vaccinology. You know, she used to stay awake late at night reading every paper that had just come out, and she was always on top of the literature. She sent me to the University of Warwick to do a course on mathematical modelling of infectious diseases. And after doing this course and publishing a few papers using modelling, she urged me to apply for an NHMRC capacity building grant to bring together the experts around the country and build modelling capacity in Australia. So I know that Terry Nolan often credits me for this, but it was actually Margaret's idea. I just did what she asked me to do, as I always did. You know, Margaret asked me to do anything, I did it. And I pulled together Niels Becker, Matthew Law, Terry Nolan, Aileen Plant, Graham Brown, and the successful capacity building grant that funded the then young postdocs Jodie McVernon, James Wood, James McCaw, Emma McBride, Katie Glass, David Reagan, who are now leaders in this field and have built real critical mass of modelling in Australia. In fact, Jodie is currently leading a bid for a new Centre for Research Excellence in Modelling, and I wish her very well in this. There are many more skills I learned at NCIRS. I really did get my hands dirty and worked on every possible task. Peter's already mentioned the Immunisation Handbook, the Myths and Realities book. I did all the grunt work for ATAGI working parties, including the work for getting the top-end hepatitis A program started. And I did the first ACR survey and numerous vaccine program evaluations. And as the only adult physician amongst a bunch of paediatricians in a children's hospital, naturally I gravitated towards adult vaccinology, which has become a major focus of my research. But really I gained my love of vaccinology and my belief in vaccines as a great public health achievement at NCIRS, and the backbone of my knowledge of vaccinology has come from there. For that I salute NCIRS, it's a really great organisation. And also my new home at UNSW, where I ventured into new areas of research in infectious diseases. So thank you again. It's a great pleasure and an honour to accept this award.